All right. Call this meeting to order. Attendance, please.
Ann, here. Artist,
Here.
Dawn,
Here.
Jim,
Here.
Mike,
Here.
Pam,
Here.
Rod,
Present.
Toby.
Here. All right, thank you. Stand for sake. We'll pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. Citizen comment, have we got any? Jill?
No,
Okay, none,
there was just a written one, but it was a student observing the meeting.
understand, thank you. Okay, we need approval of the agenda, motion for approval of this afternoon's agenda. Second. Motion's been made and seconded to approve the agenda, all in favor, signify by saying aye.
Aye.
And it's approved. Next is approval of the minutes from our January 16th, 2025 meeting.
I move to approve the minutes as presented.
Second. Motion's been made, seconded by Jim Carino to approve the minutes from January 16th. All in favor, signify by saying aye.
Aye.
Minutes are approved. Next, move on to environmental health subcommittee report. We did that on Zoom. And I guess we talked about, and Jim brought up that everybody wasn't getting all the information prior to us getting application for variances. So I think that was all taken care of. Everybody got that information, was able to go over it. We had a short and sweet Zoom meeting. And looked at the findings of fact. And voted to move that to the full board for approval, agreeing with the findings of fact. So at this time, does anyone need to have a report from Jim? Should we get that report? Might as well. I think it worked out very well for Jill to have that information prior to for everyone, so. Sir.
I'm Jim Wardiskin with Environmental Health, and the variance before you today is in reference to an incinerator system. The property is up on Logan Creek Road, and essentially it's a dry cabin that's been in existence for a long time. They do have a pit privy, an unvaulted pit privy there. So as we evaluated this, Jake Rubo from our office and the consultant hired by the applicant, Mr. Johnson, determined that there's no way to have a conventional wastewater treatment system there at this property due to steep slope and the adjacent wetland. So one of the options that they considered was an incinerator system. We've gone through this process before together. The issue that we have is that the regulations haven't kind of kept pace with technology. So the incinerator system handles all of the wastewater, gray water, black water, the solids. The problem that we have is in our regulations, it talks about incinerator toilets, not systems. And the toilet requires waste segregation for the gray water. It's not an issue with the system because it handles everything. What the applicant is asking for today is for your consideration to set that regulation aside for the waste segregation portion of it and grant variance for the incinerator system, so.
Board, do you have any questions? Seeing none? Jim?
Thank you.
I guess at this point, we would have a motion before we can move to any discussion, but have a motion.
I'll move to approve the variance as written.
Have a second? Second. Motion's been made, seconded to approve the variance for the sound campaign. I'd also like to add that we're approving the findings of fact as presented. One thing for discussion I would say was, Brad Hughes wrote an email concerning this, and he's right, sometimes we have to take care of, follow the regulations. And they would make more sense once we've already approved one of these, that we wouldn't have to go through, but at this point, as far as we can see, they have to go through this full procedure as far as these incinerating toilet systems. So any further discussion?
What is the, just curious, what is the process of changing the regulations so you don't have to continue to go through?
And that was his question, but right now we're following the regulations as presented. So it requires a variance to do this, whereas it should just be in the regulations that this would. And I believe we are in the process of reviewing our regulations, but I believe this is a DEQ regulation, isn't it?
It's our regulation and we are in the process. The environmental health staff just concluded our, review of the septic regulations and submitted those to the health officer and the county attorney's office for their review and input. And then there'll be a process going forward where, we'll meet with the subcommittee and then there'll have to be public comment on it. And then the full board of health will get to review it. And then we'll put all the pieces together. The one thing that I would say is that's one segment of it. We have the construction standards as well that we'll have to review and make sure that everything correlates. But the idea is to add language, hopefully, where it'll talk about an incinerator system, still leaving the incinerator toilet in place, but add the language for the incinerator system that doesn't encompass waste segregation. So then you're right, it wouldn't have to go through a variance. It would just be the permitting process through our office, so.
Just a couple questions for my edification. When I read through that, I thought it said natural gas as the source of fuel for the system. Is there a natural gas line out there or is this propane?
Propane, yeah, it's just a different orifice for it. And you can also use diesel or jet fuel.
Right.
So,
But this particular one will be propane.
yes.
It said in there also that there's times of the years where they didn't plan to be there. So I assume the system will be turned off. Like if they happen to be there for several months, is that correct? Or is it still running all the time?
Well, it's essentially an on-demand system. So as the use occurs, then, keeping in mind you have a conventional septic tank and a pump that pumps it to the incinerator system. So as the flow is generated, then the system will get done. It has to be housed in a structure, a heated structure, because obviously there's fluid in there, so it doesn't freeze and break.
So basically you can't turn it off.
You could, I guess, if you're not there using it, you certainly could turn it off, yeah.
So, and I assume there's not any great difficulty in restarting it up. Once you turn it off.
I don't think so. They can even, monitor and operate it remotely, so.
And then you met a pit privy. I'm not sure exactly what that is. Is it like what the Forest Service has out
Yeah,
a
so.
building where the,
outhouse.
basically the tree?
Right, an outhouse, and so they have, in this situation, it's an unvaulted pit privy, so the ones that the Forest Service or Fish Wildlife and Parks have is a vaulted one, where everything is encapsulated in that tank or vault, and then it's subsequently pumped out of it. This one, it's going in the ground, so.
Because I was wondering if you could have a backup, just in case the system failed, a backup system like the Forest Service has, where you could use it until it get repaired. But it sounds like it can repair within 24 hours or so.
Yeah.
Okay.
Any further questions? Thank you.
Thank you.
I believe part of the requirements is that they have a maintenance contract with the manufacturer of that. So hopefully things like that won't happen. Okay, we have a motion and a second to grant the variance. May I have a roll call, please?
Ann? Yes. Artis,
Yes.
Don,
Yes.
Jim,
Yes.
Mike,
Yes.
Pam,
Yes.
Rod,
Yes.
Toby.
Yes.
Right, variance is granted. All right. Next, letter has been disseminated here concerning our, support for the lakeside, addition to their, treatment plant. So, at this time, we'd like to discuss that a little bit and, see if this board is in favor of forwarding this. Their, the end of, their comment is, I believe it's the 27th. And, at that time, we can get this to them prior to that. I'd also like to hear if there's any discussion, if anyone here would like to attend that particular, meeting and put forward our support for granting the DEQ approval. So we can start the conversation. Who'd like to, Ron?
Well, sorry, well, I've had a chance to review it and I have to say, it's almost like we've got finding of facts in here. And I know that there's resistance out there with some parts of our community that don't want to see any of this. And I think being a forward-looking board, looking toward the future of our valley, the growth that's gonna naturally happen, the importance of our water quality, I think this is essential that we get this done and get it done expeditiously. And I know there's some resistance out there, but I don't think it's, I don't want to say well-founded, but I'll say well-founded. I don't think the resistance is up to par with the need. And the fact that this is, the safest option that we have at this point in time. So I'm totally in favor with this going forward. And you speaking for the board on our behalf.
Anyone further have remarks concerning this letter?
Yeah, I read through so far the DEQ provided fact sheet and the environmental assessment on this discharge permit. I think the consultant in Lakeside went above and beyond on their environmental background on that site. Montana has pretty high standards for, you guys are all aware of non-degradation. Not everybody has that, especially in the Northwest, so there's lots of conservative steps we take in engineering to ensure that we don't harm public health and the environment. I read through it all, it looks really good to me. They're gonna monitor all the wells around there for eternity. This has a 5-year lifespan and they have to reapply, so this isn't just a set it and forget it, this is something they have to meet. Pretty stringent regulations at those wells and at the discharge, so I think it was well done, and I'd like to support this letter as well.
Anything further on the board?
Thanks, that's great information.
One thing I will say is, I think that the community that is against that, the group, I think a lot of it has to do with the fact that it is in such close proximity to the lake. I mean, that concerns all of us. But when we look at the overall picture, I think the proximity to the lake, the problems with polluting the lake are being taken care of should this go into effect. So I don't think 100% for it. And we worked for a couple of years on this, I believe. I get this point, one of my council people, 15 years ago, they started working on this. Well, what can we do with all the septic as growth continued? And that kind of fell by the wayside and now it's just come to a critical point. So, did you say you would attend that hearing?
No, I did not.
Would anyone be able to attend that hearing and speak for this board?
I would, it's my daughter's last basketball game.
Yeah, I'm gonna be in Helena, so I can't, but
I was gonna be there and speak for myself, I wouldn't Lakeside, but. Yeah.
very good. Okay, so can I have a motion for approval of this letter and forwarding it?
Can I ask just one more question?
Well, sure.
Toby, what was the, if they do pick up a problem monitoring one of those wells, what's the contingency which occurs, when it's done?
Oh,
If you know.
yeah, you know, I was just researching these systems the other day, let's say, you know, the groundwater monitoring at those sites is over our limit, you know, you could either, like Kalispell's doing, apply for like, you know, upping those limits potentially. I read you could, do like some groundwater intercepting through drains or wells and kind of recycle that discharge as well, like,
I just don't have something that might reassure the people that live in proximity if there was a problem, that there are contingencies to take care of that. And the other problem might be if they can't handle the septic, is there a backup to what to do with that if some type of contamination occurs? So
Yeah.
I assume
That's
that's
a
all.
good question. I don't know that there is a backup at this point, obviously. I think that was well researched to come to that finding, and Lakeside needing to upgrade their plant and everything kind of fell into place. So, being said, I'm sorry, did I get a motion on the?
No, but I'll make a motion.
Motion to made, Dan,
I'll second.
and seconded, all in favor, signify by saying aye.
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 Motion is approved, and I signed this letter, and, you know, we'll forward that. Thanks, Toby, for stepping up to be at that meeting. I think it's really important. Next, departmental reports. We'll start with animal shelter.
Good afternoon, Austin Hicks here. The report looks pretty similar like it always does, nothing crazy on there. I don't know if there are any questions about that, but the other couple things I wanted to talk about are brand new guillotine doors have arrived. We have 29 new doors that lock and will be very nice to keep the building nice and secure. Working on getting those installed here in the next week or two, hopefully. And then also I have a brand new hire starting on Monday and we will again be fully staffed. So things are going as well as they could down there. So any questions?
Questions on the board? See, now I have one request though.
Yeah.
These are very interesting the way you put this forward to us, but personally, I'd like to see them compared to at least a year ago. The numbers, could we do that? Just do the same thing from the previous year,
Yes.
so we can compare them side by side and see if there's any way that it's going.
Yeah. Yeah.
Does anyone else feel that would be helpful?
Sure. Just for trends and stuff like
I
that.
appreciate it if you could do that.
Yes.
Thank you.
Thanks.
Community health.
Hello, my name is Rose Tash. I'm the new community health manager. So I'm really excited to be here. And I'll try to answer any of your questions, but I'm still learning. So I have in your packet is the data that we report out on every month to you. One of the things that I just wanted to highlight real quick, you may see some changes in the coming months about how we share some of that WIC data. One of the things that I'm looking into is how that data is collected and are the numbers that we're presenting to you the best numbers or the most interesting numbers coming from the most valuable data that way. In our Parents as Teachers home visiting program, we do have 2 new home visitors who have completed enough of their training to start taking on a caseload, which is pretty exciting. We've had a wait list in that program for a little while, and we'll start seeing that wait list incrementally go down as we had 2 additional staff taking on the caseload. Those are the things that I wanted to highlight real quickly. We also have our maternal child health nurse, Hannah Griffin, here today. I asked her to share a little bit about some of the programs that she works directly with. Are there any questions for me before I introduce Hannah?
Any questions? Seeing none, thank you.
Thank you. This is Hannah Griffin, I'm the maternal child health nurse.
Hey, good afternoon. As Rose said, my name is Hannah Griffin. I'm one of the nurses down in community health. About half of my job is immunizations. The other half of my job is working in the maternal child health block grant. And so we wanted to share a little bit more about what I get to do in this grant. So each county receives funding each year for staff time and projects for maternal child health services. And then more focused projects that we select annually to try and target specific issues. We can select projects based on areas of concern, from like national level data. So like infant safe sleep has been one of those projects that we've done in the past. That is a concern, all around the United States. We can also work on projects that are identified to be important on a more local or statewide level. One of those projects that we've been working on for the past year or so is called Presumptive Medicaid. Presumptive Medicaid is emergency temporary Medicaid coverage that we can get for people here at the health department, specifically for pregnant women. When someone finds out they're pregnant and doesn't have insurance, that can be a tough situation. And unfortunately for people who might qualify for Medicaid, the time that it takes from when you submit your application to when you actually get Medicaid can be a number of months. And that's a problem when someone is trying to seek out prenatal care. So what we can do is have them come into our office and we can fill out the application with them here at the health department, and they get some temporary Medicaid coverage that starts the same day. And it really helps bridge that gap to make sure they're able to get prenatal care early in their pregnancy and for their entire pregnancy. This is only serving people who already qualify for Medicaid, so they're meeting that income limit. It just ensures that they don't have gaps in coverage. This has also been a great way for us to improve some partnerships with other health department programs and with other local providers. So for example, we often get referrals from WIC or home visiting. We also receive referrals from outside clinics like Clear Choice, Heart and Hands, Logan Health. And then it's also an opportunity for us to refer out to other services that might benefit someone who has just found out they're pregnant. So we often send people to WIC. We're able to get people set up with a car seat or a pack and play for their baby. And then we're also able to refer to outside community services, like making sure they're getting connected with a prenatal care provider, housing, food assistance, stuff like that. This is a program that has been available in the state of Montana and around the country for quite a long time, but people just haven't really done it. So since we started doing this, we started tracking in October of 2023, and so we did 10 determinations at the end of 2023. Last year, in the calendar year of 2024, we were able to get 69 people signed up for that pregnancy Medicaid. And then this year already, so, through the middle of February, we've already done 12. So we're super excited about that program and being able to connect more people with resources when they're pregnant. The second part of the maternal child health block grant is the fetal, infant, child, and maternal mortality review team. This is an interdisciplinary team that reviews all of the deaths of infants and children that occur in Flathead County residents. This team consists of healthcare providers, law enforcement, mental health, and other social service providers. And they basically review all of the deaths that occur to determine if they're preventable or not. And then with the information from those reviews, we have some funding to work on projects to address the specific causes of preventable deaths here in the Flathead Valley. So last year we had done seatbelt safety with teenagers. We've done some kind of competitions with local schools to promote seatbelt safety and education around that in their student bodies. And then this year we're working with Logan Health Outpatient Behavioral Health to distribute gun trigger locks in their clinics. So ensuring that firearms are secure and inaccessible to children and teens is one of the most effective ways to help prevent suicides and other firearm related deaths. So we'll actually be rolling that out in the next week or two here. So their providers will be able to give out a gun trigger lock to any family that is interested in receiving one. And then hopefully help prevent, children or teenagers accessing firearms that would be unsafe for them. So that's a little bit about what I do, maternal child health. Are there any questions?
See you. Thank you.
Okay, good afternoon, Lisa Dennison with Population Health. So starting off on the communicable disease side, as I'm sure most folks have seen, that we've seen an increase in influenza, both on a local and national level. At the end of last week, we had almost 1,300 cases of influenza reported to us this season. So, that was reported through just our key surveillance, activities that we do every week. What's been kind of interesting about this season is that we are seeing similar trends that model what we used to see prior to COVID. So we're seeing more the increasing in peaks at the end of January, early February, mid-February. So just kind of an interesting observation that we've encountered this year, whereas last few years has been much different than that. So I'm sure we'll continue to see some cases come through as the season progresses. I know last month I did mention about pertussis. As you see on the report, we continue to see those cases come in, and the staff are still doing an amazing job with investigating those cases and doing that education to the families about illness transmission, prevention, and education and things like that. And then moving on to the other side of population health, chronic disease and injury prevention. Wendy Olson-Hansen, one of our health promotion specialists, has been working really hard the last couple months to bring into Montana a safe travel for all children's class, which will be held in Missoula 8 and 9. So what the class is actually for those car seat technicians to further the education and knowledge on adaptive transportation. So those technicians can learn information about some of those medical conditions and some of those special needs kiddos that have needs that impact how they're restraining in the vehicle. And then learning how to actually install some of those adaptive restraints. So it's just a great opportunity for some of those technicians to further the education on some of those special needs and medical conditions that require that change. And then just making sure that those kiddos are properly protected when they're riding in the vehicle. That's pretty much all the main points that I have, unless there's any questions.
Just want to say, the varicella, taken back to those, all children.
Interesting enough, it's ranged from younger school age kiddos through some adults as well. Yeah, good question.
Further questions? Seeing none?
Thank you.
Behavioral health.
Afternoon, James Pike, Behavioral Health Supervisor. Most of the data here was kept in a similar format, so I'll just try to highlight some things that popped out to me as I was reviewing it. Given the presenting issues here for January, suicidal ideation rose in both gross numbers and proportion of presenting issues by quite a lot actually this month. And so it'll be interesting in March to get the 988 call center data and see if they're seeing a similar uptick there, or if this is kind of an outlier month, but that is something that that we'll be watching. On the next page there, Janelle, our client interactions went up quite a lot, and that's because in December, we had a provider on leave. So in January, we returned to a fully staffed 7-day program. And so just by the nature of having 2 active teams for the entire month, we just were able to serve more people. Then in the utilization category, there was some feedback last month about breaking up how much people are utilizing our services. So I put multiple utilizers as 2 to 4 interactions in the month, and then I backdated that to the previous month as well, so you can see that. And then our high utilizers are 5 or more interactions in a month, which sits at around 4. Some of those people are the same month to month, and some are not. But you can see that trend of several people using a lot of the system continues. Then the age distribution, I broke it up by generation. This time around, I did cross-reference that with presenting issue, and there was not a remarkable trend this month. The presenting issue and age type were scattered across the board. So again, I will continue to watch that, and if the trend line exists, I will certainly present it here. Then the last page, most notably, our jail diversions went up quite significantly. I'm not sure exactly what the driver is for that, but up from 4 to 18, December to January, and the ER diversion number, we like that too, certainly, but that big jump in jail diversions for the individual, it leads to a better quality of care and just better progression to get healthy. And for our county, that is quite a significant cost savings for the month. Any questions?
Questions, anyone?
Just a couple, remarkable to see the data. I have to say, I wonder what we did without this, right? You know?
Yes.
It really is, remarkable. So thank you for that. Two things with I like that you did break out the age. I was looking more for just, instead of having, big spikes, and I see we still have them, even though we went from 4 categories to 6. It may be helpful for others. I like how you did it, based on the demographics, but maybe put in parentheses what those age brackets are.
Yeah.
For people when they're looking at, millennials or 29 to 44, just have it in there. I'm looking for the demographics, but I think to have the age actually listed in there is still important for folks that don't track socially the way I do. And then I have, one other question with the suicidal ideation. Is that coming through 911 calls, or is that?
It's not. This is a really good question. So there's this, and this is where it gets tough to compare across facilities and systems. So the call to 911 might be a welfare checker, domestic disturbance, or substance abuse or something like that. What is listed here is when our providers respond to the client, what they see as the primary presenting issue given their assessment. So that is a field-based assessment. And that would be a different number than the call to 911, depending on how that's reported. And that would be different from the 988 call center, because that would be a self-report situation. And then the hospital would again categorize that differently, depending on how they triage that patient.
Okay.
So for this number, this is assessment based, and I like the number for that reason.
Okay. And I guess the only other thing I would like to see, and we don't have the data for it yet, but I'm just wondering if with the suicidal ideation, if any of that can be, and we'll see it as we go through the year, but if that seasonal affective disorder, are we seeing a spike in that, in these winter months and that sort of thing. So it'll be interesting to look at that data as we get more of it.
Yeah, we definitely had more mental health calls in January, just in the county, than we did in December. I think the proportion being due to suicidal ideation is more remarkable than the number in this case.
Yeah, just a question, how are you going to present this data? Is it gonna be like quarterly or month by month? And you're gonna put it in tabular form or have different bars under each one, just so we can compare?
Yeah, so the presenting issue could be month by month, and then I can work in quarterly data as well. And that would incorporate EMS, law enforcement, detention, et cetera, that we get quarterly, so I can kind of pepper that in a quarterly report.
And month to month is fine, I just mean, when you present, obviously you can't present this graph unless you're some variation, so you know, compare February to January, so.
Yeah, I think as it builds out and we get consistent data tracking for several months, we'll see how it presents best and is readable for you all to be able to follow along.
Any further questions? I just have one comment. It's impressive. We talked about getting this going for a while, and now that it's on the ground, get to ground and running, it's obvious the need that was present. So Thank you.
I think there is, and the partnership with law enforcement has been, wonderful and really, really productive. And we look forward to partnering more with our EMS responders. I think that's our next kind of window of opportunity.
Very good, thank you.
Thanks.
Is family planning?
Good afternoon, Mandy Fleming with Family Planning. We had a pretty average month in family planning clinic-wise. I did want to highlight January in our community presentations and classes. Our health educator, Andy, did a lot of work in January. This is the time he goes to classrooms at the end of each semester and presents on pregnancy prevention and STI prevention. So we met with over 700 individuals in the month of January. Our harm reduction program was pretty status quo. The only thing to mention is we did receive funding for our opioid education and naloxone distribution program for the next 3 years, so we can continue those efforts over the next 3 years. Any questions?
Just one, many thanks. The numbers for the harm reduction go down pretty significantly, through the past 3 months. Is that because people leave the valley at that time?
I think during the cold months, we typically see a lower usage rate.
Even further. Thank you very much. Environmental health.
Hello, Jim Wardinski again with Environmental Health, and, first I wanted to thank the board for, their diligence and review in that variance process, and I think we're streamlining it. I think, you know, being a little more communicative with each other and getting you the information ahead of time so you can make an informed decision, so, I think that's panning out. One thing that I would like to point out, pertaining to the variance process, and, the comment was made about, the incinerator systems and, you know, obviously we're working towards a regulatory change, so we won't have to have a variance hopefully. But in the interim, one thing that I'll share with you, as you're looking at the findings, one of the things, usually with the findings, when you're looking at depth to groundwater or whatever it is, we're looking at, non-degradation issues, things that are a hurdle, setbacks, stuff like that. With these variances, regarding incinerator systems, usually we don't have, any non-deg issues. However, the two things that that become important with incinerators are the hardship, finding, and then the extraordinary circumstances. So the example that I would utilize is, if you recall the incinerator that you guys approved for the, Ashley Lake one. In that situation, you know, completely beyond the control of the applicant, the neighbor where the easement was, they built a garage over top of their drain field site. In this particular one, I actually reached out to the county attorney's office because as I was trying to evaluate, you know, what is the extraordinary circumstance that we have here? And so we discussed that, and, what I came up with is, you know, they had this existing pit privy that was allowed based on the regulations at the time it was installed. However, the regulations have changed and now it's not allowed and it's in violation. So if we take that from them, they have no means of sanitation. So that was kind of the extraordinary. Well, yesterday I sat down with a gentleman who purchased a piece of property, groundwater monitored, and, the depth to groundwater is like 6 inches. And, you know, he said, well, that's okay, we'll just go through the variance and get an incinerator. And so we sat down with this finder and I walked him through the findings. And when we got to number 9, and I said, what is your extraordinary circumstance that was not, you know, that you cannot prevent? And he said, well, the realtor told me I could get a sand mound. And, I said, well, I don't know how the Board of Health is gonna feel about that, you know, in comparison to these other ones. So, the reason I bring that up is I think until or if we get the regulations changed, if we see any more of these, just kind of keep that in mind as we look at this, and that's why probably we have to do these individually, because of the characteristics of each, application, so. I guess, the next thing I'd share with you is we're on the cusp of, engaging in groundwater monitoring. So, and I've shared this before, but a couple of things that we've done to try and improve people's success with that is, we've, with the help of Mandy and, some of the environmental health staff, have generated a video that's now on our website to kind of show why we do it, how we do it, the pipe installation and all that. We have a demonstration pipe that, I've constructed and put in, our lobby there. And, I constructed that based on the construction standards. And I know there was a concern about, the structural integrity of that pipe because I slotted it instead of having round perforations. So Fred and I did a little experiment out in the parking lot, and I took video of it if you care to see it. But I drove my 3/4 ton long box 4-door pickup up on top of the pipe as it laid flat in the parking lot, parked it on top of the pipe, rolled over it, drove back up on it, parked on it, and drove over it. It didn't crack, it didn't break, it didn't cause any issues, so I feel completely comfortable, coupled with the fact that that's how they say it's supposed to be constructed in the construction standards. You know, so, again, you know, we're just trying to get that information out there, make sure that it's good, viable information, to help improve the success rates. The last thing that I'll mention, and we're just trying to work through some of these things. In the recent past, we were alerted to some scenarios regarding sanitary restrictions on properties. Some of which we found, and I won't say a substantial amount, but there are some out there that during a time frame, I think in the 1970s, some erroneous sanitary restrictions were placed on properties by the county. And as those are identified, we've communicated with the county attorney's office, and we're working on a process to remedy that. If proof is generated by engineers, consultants, surveyors, whoever, or our office, that can be provided to the county attorney's office. They can write a letter on it. It can be filed with the clerk and recorder's office, and then those restrictions can be removed. The other thing that we learned is just because sanitary restrictions aren't reflected on a certificate of survey, that doesn't mean there aren't any. Again, there's some timeframes there where there could be what they call implied sanitary restrictions. So again, we're trying to navigate all that. And, you know, as I've talked with the county attorney's office, I said, you know, we're not attorneys, you know, we're trying to sort through this stuff. And they said, yeah, you know, it's a sticky situation because potentially there's some liability for us. So we're doing our best to work through that, and you know, we'll put some procedures and protocols in place. And continue to communicate with the applicants. And again, this is part of the reason why we're doing this land research stuff as the very first step to try and identify these things. But I just wanted to make you aware of it, that it's a scenario that we're trying to work through, so. Yeah, that's all I had.
Comments, questions? Thank you. Finance report.
Good afternoon, Kirk Zander, accountant for the health department. Finance report is for the month of January. And of course, we're right in the middle of the budgeting process, getting that started. But one of the bumps in the road that we may have to come across is there are several property tax proposals before the legislature that may affect what goes on. So we'll be keeping track of those and hopefully getting some guidance over those over time and see how those work out. So in the meantime, the budgets, you know, we are conservative on our budgets, but we'll be extra conservative. So anything that we can find and narrow up just to make sure we give us as much room as possible. Again, we really probably won't even know until May sometime, I would imagine, when everything's all said and done. But we'll discuss more of this in the finance committee that will meet in the second week of April or so. So we'll take a chat on that. Cash balance for the year, 1.4 million versus 1.3 a year ago. So a little bit, a little room there. And the only other item that I had, payroll expenses showed a negative variance for this last month. Just because we got a third payroll that happened in January on the 31st, so that will get advertised over the next couple of months, so. Any questions?
Questions? Tina, thanks for the report. Officers update.
So I do want to welcome officially Rose Hash to our team. Rose was with us years ago as a health promotion specialist, and her and I actually got our MPHs together from the University of Montana. And then she went on a little bit of a walkabout, so to speak, and came back, and she has her RN and so bringing some great public health background, and we're happy to have her back. So I just wanted to officially welcome her back to our team. So budgets, Kirk kind of stole my thunder there, but budgets are in full swing. Legislation makes everybody a little nervous about some of the things that are happening. Pam could probably speak more to that, but we are cautiously looking at all of that, and then also looking at health department as a whole of where we would maybe need to tighten some things if we needed to. So that is in the discussions. I'm probably gonna make Kirk grayer than he already is after multiple conversations. So I do want to thank Janelle and Gil from IT. They have worked very diligently to try to get this system up and running, which was a legislative mandate, unfunded, that we're just hopefully going to be able to have everything to what they wanted. What we were doing before was we were videotaping and we were putting it on YouTube, but YouTube isn't considered a long-term holding thing. So then we actually had to go out and get a contract with, much like the commissioners and the city councils, that is now with Adobe, where they keep it forever. So that has been a significant upgrade in the systems that we've had to do, and to be in compliance with that. So thank you, Janelle and Gil, for working on that. She spent hours and hours and hours in here doing this, so we appreciate that. The other thing is Keelani and a few of our board members were able to go to the Board of Health training. We're gonna try to come up with, I'm gonna talk to Tara Regina, and I'm gonna try to come up with a little bit of cheat sheets of things that maybe just to highlight some of the things that were brought to our attention, that were some things that maybe changed in MCA, how we do boards and things like that, just an FYI for those that weren't able to attend. And then we do still plan to have the MACO attorney come in after legislation to be able to do a board training. So we'll do probably a board retreat maybe in April or May, and be able to talk to the MACO attorneys to kind of find out why we do the things with environmental health and kind of the role of the Board of Health, and be able to have you guys ask questions and those types of things. Just so that we kind of do a board training, so to speak, and be able to have an expert be able to answer any questions and that type of thing. So that is still on the agenda to do. It's just, she asked for us to wait till after legislation. So I think that's what everybody's waiting on. But that's all I have right now, unless anybody has any questions. I do want to thank Toby for putting together the letter, and then Jim for doing some edits and just making sure that, everything lines. So I do appreciate you guys that, and Don, I appreciate you bringing it up in the subcommittee, and also that we were actually given an extended deadline to be able to submit that letter, because it is very important, so.
Yes, it was. Anyone have any questions of Jen? Seeing none. Board member discussion? Anybody like to discuss any ongoing events besides I don't know, the chaos in Helena?
I didn't know that could have started. I'll be here. No, I'll just keep my thoughts to myself. Summation. Oh, just a summation. Oh, my gosh. Well, the narrative, of course, has been for the last year or so, that local government is out of control with their spending. And in reality, local government is the only part of government in the state that's capped. It's been an interesting discussions. I've had several interactions with many legislators and the governor and watching a lot of committee meetings, weighing in on a lot of stuff. One of the bills was gonna cost the county roughly $600,000 in our general fund. We did get that bill put aside, but in reality, until they sign die, anything can happen. I did get an email or a text last night after 8 o'clock that 2 of the bills I've been working on got tabled in committee. And that had to do with levies and how levies are done in the county, and it was just unreal expectations that they wanted. And it would hamper how local government does business. And including cities, of course, local government. So 2 of those got put, like I say, got tabled, but then just before I got here, I was watching a committee meeting. And another one pops up that's real similar to what we just tabled. And he even said in his comments that this is kind of the backup bill. Okay. So it's a constant surveillance of what they're doing, and you still don't catch it all. Because everything's happening so fast, and I have other things I have to do, and of course, Mako watches them very closely, Montana Association of Counties, so. They're doing a great job for us. We actually go to Helena, I go to Helena Monday. I won't be back till Thursday. I'm gonna try to make the meeting, but I don't know what time I'm gonna leave Helena Thursday. So, it'll be 4 days of. Usually there's a lot of meetings at the motel, right? A lot of convention stuff, but this year we're gonna switch it up and we're gonna be over at the Capitol probably every day. Just because of the need for that, so, yeah, it's always a win when I get a couple votes switched the other way. It wasn't enough the other day to kill a bill, but it's been incredible. So, yeah.
Constant vigilance.
Oh, yeah, you gotta be on it and keep watching because you think you're done and then, like I say, the sister bill pops up, right? And now we're going at it at a different angle, but it's gonna have the same effect, right? So anyway, yeah, so just kind of watching out over local government. School funding, that's another whole discussion. Yesterday it was, or I don't know when it was, I was watching a meeting. It was a house session. And they decided to take the cap off of some of the school funding. It was capped at 3%. And it's the school funding that the legislature sets the amount. It's not done by vote or anything like that, but it's a legislative set amount that the legislature can assess for school funding. Well, they lifted that cap and they put it at whatever the inflation rate is. Well, that's gonna be kind of troublesome, I think, at times, because if you got a 5% inflation rate or 7% or whatever. The argument on the floor discussion was, well, they won't go to the max. Okay, I'm sorry. Anyway, they're trying to get more people to the polls, which I don't think you can do legislatively. People are they're gonna vote or they're not gonna vote. So they're trying to make these benchmarks so that they can get people to the polls, and it's not gonna work. So they think they can fix that. What else? Whether there was another school bill, which I'm not quite sure how that's gonna work yet. It actually passed 2 years ago. Didn't get implemented until this fall. And now it's already got a sister bill to bump it up a little more. So I'm watching that one real close, and it's hard to tell what the effect's gonna be. It has to do with the 95 mils. So I don't know yet where that's going, but it may be actually helpful to the county. But they say it's gonna be, but I gotta see some numbers. So anyway. Anything else? I mean, I could go on. No, I'm done. But if you ever get a chance and you want something to do in the middle of the night, just go to the Montana Legislature website and watch some committee meetings and floor meetings and just, you know, yeah.
We'd like to sleep, but we'd have to stay up way, keep us up at night.
Anyway, yeah, it's interesting.
All right. Do you have any further business?
I just have a question, Don, just for the board. When we do get a public comment we had last month, it's not an action item for the board, but does anybody feel like we ought to respond in some way to people that raise a concern when they come here? Like with a letter that we thank them for coming and this is what our position is on it, or?
That's an interesting question, because I was just going over some policies and procedures in the city. And, what I found is when someone does that, there's actually an avenue that says that you can have a discussion, but it's not an action item. So no action can be taken on it. I don't know here where you would do that. Would you do that after the presenter? They came with a public comment?
I would assume it would be in the board member discussion if you want to discuss it.
Well, the way we have, of course, we're a small board, so we're a little different rules, but she came forward with a concern. We get it all the time and they have a concern. And normally, whichever district that person lives in, the commissioner takes it on.
Yeah.
And then we have a communication with that individual, whatever it is, and try to resolve or talk about what their issue is. And 9 times out of 10, we get it fixed. So I think here it would probably be more fall on the health officer to just have a more of an in-depth conversation with her. And then maybe have, you know, tells her the do's and don'ts, because you're familiar, I'm sure, or could be familiar what she's talking about. And give her all the data you can, right? And a lot of times that takes care of it. Now, if it doesn't, she can request coming before the board. But I can't speak for the Board of Health, because I don't know how we do that, but for the commissioners, it takes 2 of us to put it on the agenda.
I mean, it could be at a request of mine to put it on the agenda, or any one of our board members we can go to the chair and ask for something to
Does it
put
only
on the
take one?
agenda. I think so. I think the board chair can request it.
Okay.
I haven't heard that it needed more than one.
Yeah, it's all however you want to put it up. We just do 2.
Yeah, applicably, I can call her. We have no jurisdiction of what she was talking about,
And
so
maybe that's all you have to say to her.
Yeah,
Right?
and because I believe she came to the commissioners, and then the planning and zoning office told her to come here. And they're who I would refer her to, so, but yeah, we could definitely follow up with those things. I think if they need to.
I wonder to make those folks that do come forward, and that's a big step for most of them to come
Well, that's a
forward.
good question to ask when we have our retreat and talk to Mako and say, how do we handle that, right?
And even if we did have a discussion during the board discussion, if that comment was brought up, that's what we could ask. Jen, Jen, would you please take care of that? And that's gonna make that person feel much
Yeah.
better about it, don't you think? I mean, that's how it kind of works in the city. At least that's what I try to do.
In the city, you don't address it because it's not on the agenda. That's right. Right, so you could address it at the end. What I found after, 7 years sitting in city council, no one ever sticks around to listen to what we have to say at the end. So we would address a lot of things that were brought up, correct and that sort of thing, but they were never there to hear. They said their piece and left. And that doesn't mean it's not deserving of a response. It just means that they weren't here to listen at the end, but just for order of business, it would have to be at the end because it's not an agenda item.
Well, and who sets that order of business? I mean, couldn't you bump that up? That portion of board member discussion, bump it up after that? You know what I'm saying? In other words, could you allow that, a short discussion shortly after the presentation?
Well, normally
Because
you
people
get
do
right into
that.
business. Normally you have stuff you gotta get into.
Well, that's
And a
true.
lot of it's timely. We approve the agenda first, and there's a reason we approve the agenda. So you would have to have a motion to change the agenda.
Yeah, modify the agenda, whereas.
Yeah, I think it messes with the whole flow.
Yeah, I understand exactly what you're saying. I just want to, folks, if they wanna come and make sure that they understand that we're listening and that we wanna take care of whatever we can, and like I say, oftentimes it's gonna fall in your elbows.
I mean, I don't think you have to make an agenda item, but to help you out, it might be reasonable for, after an issue is raised, that we could research a little bit and then provide some input to you, either in the form of a letter or whatever, and then you could, if you found that adequate, you could send it, and that's a nice way to treat a citizen. Or if you felt it was something that really did need to go on the agenda, then you could put on the agenda the next time, but we could give you input too, for example, with her concern. I mean, I looked into that as much as I could, and there just isn't the data out there to back up a big concern about it at this point in time, although interestingly, RFK Junior has documented he wants to look into that a bit too, so there may be some more coming out, but at least we could provide you with some help on that if you desire, so.
Okay.
But the other thing I'd say is, as a board chair, you can make sure you ask them to make sure they leave their contact information. How we do that with us, yeah. So
Do folks here have to sign in with that information when they come, or when they request to address the board? Do they have to leave that information already?
When they request online, they have that place to put their address and all their information.
But you just for clarification, so if someone just came to this meeting. And
They sign
and they hadn't asked to be on public comment, can they still comment? Yeah, it's like, oh. So, yeah, exactly right. That'd be the way to take care of that, make sure that we have their information.
just follow up.
Yeah.
Yeah, as chair, all you have to say is, please leave your phone number with the staff and someone will get back.
Yeah.
Someone will get back. You don't have to specify, you don't have to. Because then it depends, maybe if it's something that Jen would rather have, Mr. Baharski address, then she could have him do it.
Right. Okay, anything else? Seeing none, may I have a motion for adjournment? Motion been made and second to adjourn this meeting, all in favor?
Aye.
We adjourn.